What we're seeing right now is frostbite from 2 weeks ago, right? We have had multiple calls from hospitals of patients who needed placed in our medical respite.
This cold weather is especially dangerous for those in our community without homes, but our healthcare workers are dedicated to trying to keep them healthy. KSHB 41 News reporter Megan Abundis got a look at a day in the life of doctors and nurses doing this life-saving work.
I'm Megan Abundis. When the temperature is well below zero, there are a lot of considerations to take to keep yourself safe. And when you're living outside, homeless, even more. While the temps change, the circumstances do not. In Kansas City, there are doctors and nurses who treat people to make sure they are safe. Patients like Anthony,
I know what you're saying,
who was so cold they couldn't get a pulse ox reading on any of his fingers, aren't alone.
The things that we're seeing right now are people just coming in frigid with nothing.
Nurse KK Janelle Osman, who started Care Beyond the Boulevard, will tell you
when the snap hits is not when we see the fallout.
It's weeks later.
So for the last week, we've gotten numerous calls to our medical respite for people who have had amputations, frostbite injuries, things like that as a result of the first cold snap. So we haven't caught up with that yet, and now we have this.
They provide regular health care and post-acute care to those homeless in Kansas City. And when it's cold,
hot hands, tarps, coats, blankets, gloves, things that can keep digits and people alive. People really do stay outside.
Evidenced by the fact that fire crews put out an out-of-control fire in an encampment downtown.
Last night, it was really, really cold. I cannot imagine sleeping outside in this cold.
While she says the cold weather shelters have increased capacity at night, the cold still forces lifelong issues for people living outside.
Hypertension, diabetes, those same things. But then when you compound them with the weather extremes, then it makes their health conditions much more difficult.
She says people do care about their health. Last year, Care Beyond the Boulevard saw 3,000 patients and had 12,000 clinic visits, proving that people want medical help. But she says it can't always be the priority when trying to find somewhere to sleep. Megan Abundis, KSHB 41 News.